Camila Garcia is 58 years old. Although she's physically active at her job, she does not get any exercise otherwise. She does not eat a healthy diet. She struggled with her weight most of her life. She lives with her mother, brother, and daughter, all of whom are also overweight. And Camila is also a smoker. No one in their family receives regular health screenings. However, they each recently had a complete physical with blood work for the first time in many years. Camila and her brother were both diagnosed with prediabetes, and their mother was diagnosed with type 2 diabetes. The table talk topic I would like to address with Camila are lifestyle changes she could adopt in order to prevent type 2 diabetes. Hello, Camila. My name is Anne Marie Langfeld, and I'm a nurse at the Christ Hospital. I understand that it had been a few years since you'd seen the doctor and you were recently diagnosed with type 2 diabetes.
Yes, my blood work showed prediabetes, but I didn't think it was that serious. It's not like diabetes. I don't have to take anything for it.
Having prediabetes means your blood glucose levels are higher than normal, but not high enough to be diagnosed with diabetes. Unfortunately, both prediabetes and diabetes are a progressive disease. Most people who are diagnosed with prediabetes end up being diagnosed with type 2 within 10 years if they do not make the lifestyle changes needed to halt the progress of this disease. Fortunately, you were diagnosed before your condition progressed to diabetes. So if you take action and make the necessary changes to your lifestyle, you could slow the progress of your disease or possibly even prevent it from ever developing into type 2 diabetes.
My mother was recently told she has type 2 diabetes. My brother and I both have prediabetes, so I'm worried my daughter might get it too.
Diabetes does run in families, but genetics is only part of what predisposes a person to diabetes. Lifestyle also plays a big role in whether someone is at risk. I'd like to talk to you about what causes diabetes and some key lifestyle changes you can make that will help slow or prevent the progression toward type 2 diabetes.
I really want to learn more about diabetes so I can help my mother be healthier and to keep the rest of my family from developing diabetes.
Well, I'd like to start by explaining the progression from prediabetes to type 2 diabetes. Most people with prediabetes are insulin resistant, which means their bodies can't respond properly to the insulin they make. Over time, their blood sugar levels increase as a result, which can lead to type 2 diabetes, heart disease, and other vascular complications. Insulin resistance can be caused by a number of different factors, such as smoking, eating a diet that's high in refined sugar, and a lack of exercise, as well as genetic predisposition. Now that you've been diagnosed with prediabetes, it's crucial that you see your primary care physician regularly in order to monitor your A1C, which is a blood test that measures your average blood sugar over a 2 to 3 month period. This was the test used to diagnose your prediabetes.
Yes, my PCP wants me to have the A1C again in 6 months. I'm hoping it'll be lower so I won't have prediabetes anymore.
It's imperative that you take the steps right away to lower your A1C and your risk for developing type 2 diabetes. Camila, could you list the healthy behaviors we've discussed that are crucial for you to adopt in order to slow down or prevent the progression from prediabetes to type 2 diabetes?
Yes, I can. I need to see my PCP regularly to have the A1C. I need to stop smoking, eat healthier, and watch my sugar intake. And I guess I need to start exercising as well. But I feel like I already get a lot of exercise at work.
Although you do physical activity at work, your body has likely grown accustomed to that level of activity. In order to lose weight and get healthy, it's important to increase your daily activity. One strategy would be to build exercise into your daily routine, such as walking for short trips. Take a break and do some stretches or lifts. And on days that you're not working, you should try to start an exercise routine, such as taking a brisk walk. A good place to start is to exercise 30 minutes a day, 3 days a week, and work up to 30 minutes a day, 5 days a week.
The more I think about it, maybe starting an exercise routine would be the easiest part for me. It's going to be hard for me to quit smoking. My brother smokes and we live together and work together.
I understand that it is very difficult to quit smoking, but smoking cessation is an important step in decreasing your risk for developing type 2 diabetes. Smokers are 30 to 40% more likely to develop type 2 diabetes than non-smokers. There are many resources available for support in smoking cessation. Here's the list of those resources.
Thank you.
For example, you can call 1-800-QUIT-NOW for free coaching, a free quit plan, free educational materials, and referrals to local resources.
I've been wanting to quit for a while, but I know it's going to be tough for me. So is the diet. Anna, my brother's girlfriend, does a lot of the cooking in our home. I know she's concerned about Miguel's weight and his health, so she might be open to cooking more healthy meals.
Since you and your brother both have prediabetes and your mother has type 2, it's crucial that you all follow a low carbohydrate, low fat, high fiber diet. That diet will benefit your brother's girlfriend and your daughter as well.
I know Anna and Marina would both like to lose weight.
It would be great if your family could all support each other in that effort. Here I have a pamphlet for you about planning healthy meals that you could share with the rest of your family. This talks about making healthy food choices. This goes over some of the things that are really important to keep in mind when you have diabetes or prediabetes as far as what you should be eating. This discusses portion sizes. This discusses the healthy plate and how you should be looking at non-starchy vegetables, your carbohydrate, and your protein choice. And then here, Cornerstones for Care is a website that you can go on that has lots of information about prediabetes, diabetes, and keeping yourself healthy.
Thank you. This information is going to be very helpful, but the thought of losing weight is so overwhelming to me.
An important thing to remember is that modest weight loss of 5 to 7% of body weight, that's just 10 to 14 pounds for a 200-pound person, has been proven to reduce the risk of diabetes.
Wow, if I look at it that way, it's not so overwhelming.
The good news is that there are lifestyle changes you can adopt or to prevent or delay type 2 diabetes. The National Diabetes Prevention Program is an online resource through the CDC that has been proven to help people make these lifestyle changes. To recap, if you stop smoking, start exercising regularly, and eating a healthy diet, it is possible to reverse prediabetes and prevent the progression toward type 2 diabetes. Camila, are you able to tell me in your own words what your diet and exercise plan is going to be?
Yes, I can. I'm going to try to exercise for 30 minutes, starting 3 times a week, then increasing to 5 times a week. I'm going to eat a low-carb, low-fat, high-fiber diet.
That's right, Camila. I urge you to utilize the smoking cessation resources in this diet and exercise information.
Thank you.
As you move toward a healthier lifestyle.
Thank you.
In this table talk, I utilize Chunk and Check with TeachBack as my educational method and also summarize the information provided. Thank you.